Welcome to another episode of Medicare Industry Insider. I'm Jalen Jackson.
I'm Rachel Bremeyer.
And today we're going to talk a little bit about durable medical equipment, or DME, and talk about some of the challenges, trends, and a little bit about how to help your clients when it comes to durable medical equipment. So, first of all, what is durable medical equipment? Predominantly things that are covered by Medicare Part B, or what we're going to be talking about today if you are being prescribed it by an enrolled provider, and if it is something that is expected to be durable, which means not one-time use, not used for just a couple times, typically has to be usable for, in many cases, several years to be considered durable medical equipment. And that includes a lot of really commonly used items like blood sugar meters and the test strips and medications to go in them. Things like canes, commode chairs, crutches, home infusion services, certain hospital beds, Lancet devices, in some cases, nebulizers, oxygen equipment, patient lifts, suction pumps, tractions, walkers, wheelchairs, and scooters in many, many cases. It is a whole plethora.
I feel like that should be a rap song.
Yeah.
Just like say it really fast.
A whole plethora of items that can help improve patient quality of life and help treat certain disorders. And luckily, there's pretty decent coverage for these items.
For sure. So with durable medical equipment, thankfully, that is Part B with most things, and you'd pay that 20% Medicare approved amount. A lot of times, if you have a supplement or advantage plan, it helps you with that. There are different things that you need to double check, such as finding the right facility that actually, or right organization that can provide it, that is Medicare approved. Sometimes you may need to rent an equipment instead of buying it. And sometimes you get a choice. So we'll kind of dive into that as well. But I want to backtrack just a little bit, because the DME market is a $63.1 billion U.S. size market size in 2023. This is according to Grand View Research, with the main DMEs being wheelchairs, scooters, walkers, canes, door openers, and other devices were like a smaller percentage. So you're looking at mostly like walking devices, things like that, but also infusions like you mentioned with pumps and things.
Absolutely. A lot of things to help with mobility. And yeah, like you said, lots of ifs, ands, or buts of renting versus buying versus whether you have the choice or whether you're required to get it one way or another, and then also making sure you find an in-network provider. And then the big question that we get a lot from agents and agencies is, first of all, does Medicare cover this? And then as a natural next step to that question is, how does Medicare decide what to cover?
Yeah. So there is a transitional coverage for emerging technologies pathway.
Yeah.
So a TCET. This organization uses national coverage determination and coverage with evidence development, or CED, processes to figure out exactly what is going to be basically approved or not, based on potential harm and benefits with the technology, and also identifying if it's important for evidence gaps. So this organization, basically anything that is created or new, has to go through this approval process to become a official DME. So it is kind of interesting that you can't just be like, "It's a walker, here you go."
Yeah.
It still has to get approved.
Well, and really the benefit of this new TCET process, this transitional coverage process, is that it kind of expedites that national coverage determination. Every product, service, medicine, whatever, that is new to market goes through a coverage determination before Medicare will cover it for most beneficiaries. So this expedited process just brings, someone brings a new medical device to market, this can get it in the hands of beneficiaries a little bit quicker and start using that to improve lives. But there are some things that are not durable medical equipment that may serve as a lower cost alternative for certain features, particularly when it comes to things like emergency alerts. So you've got smartwatches that have many a growing list of emergency features, everything from fall risk sensors to being able to detect heartbeat to many other things that can help improve and monitor the health of somebody. And then even things like Alexa or Google Home or similar services like that that can be used to notify the authorities in the event of an accident, or making sure that people can stay safe at home, get questions answered, schedule doctor's appointments. This is not an artificial intelligence episode, but we should probably do one. But my goodness, do I have some thoughts on how that's going to get into our life in the very near future.
Noted.
Yeah, for sure.
But I think that's a good point you brought up with like DME alternatives. Those are, a lot of people assume like, oh, a smartwatch that'll be covered by Medicare, maybe if I, a Fitbit or something like that helps me get healthy. Those typically are not covered. I do know there are several Medicare Advantage plans who may give you a reimbursement or even provide one for you, but across the board, it is not something that is an approved DME product. It was interesting too, because we were looking and I was like, I'm thinking about technology and how different technology could help. And I was like, I have an Alexa and a Google Hub. Could they call? And I looked it up, and you actually do have to pay a monthly subscription to have an emergency assistant. So it's not automatically built into a lot of these, which is probably good, because if you've got a kid, they're going to be like, call 911 just for the heck of it to see the fire truck, because who wouldn't want to go see a fire truck? But
Sure.
Just as a note, something as an agent, if you're looking at helping your client, if they're looking at finding DME alternatives, maybe things like especially the fall assistance, that's just an extra fee that they would have to implement if they wanted to use that. Some other things that, as an agent, just knowing what things people assume are covered that's not actually covered.
Yeah.
Before we dive into all the DMEs that are covered and kind of what that actually means and elaborate, going over some of the misconceptions that a lot of agents usually have, or not just agents, just people in general think like it should be covered. And I'm specifically going through a lot of this myself of, basically caregiving for a father-in-law, but there are things like the assistance to get him on the toilet where he doesn't fall. You have to pay that out of pocket. Any like rails or grab bars, if we added those to any place he ends up at, that's not covered. Even he was struggling to get socks on the other day, so we bought one of those. Basically, you can put a sock on and you stick your foot through it and you pull it up so you're not bending all the way over. There's little things like that where just to have him do basic activities of daily living, he needs assistance with that, and maybe he could still do it by himself, but there are things that we have to buy that are out of pocket just to get him to the point where he can do things by himself.
Absolutely. And so many of those home modifications, ramps, widening doorways so you can fit a wheelchair through them, things like incontinence supplies, compression leggings, and then, anything disposable, like we talked about. This is supposed to be multi-use things. So things like, even though it may be related to a long-term illness that requires other durable medical equipment, maybe related things like gloves, gauze, face masks, supplies like that, not going to be covered under the DME provisions of Medicare.
Yeah. So I think those are really big misconceptions, because a lot of people think like, oh, I've got Medicare, it should cover almost everything if I ever needed any of that. But some of those big expenses, that's why, either having savings or having some other alternatives, maybe you have like a hospital indemnity plan or something like that would just give you a chunk of money so that you can use it however you would like. Home modifications are very expensive, especially if you've got someone who's able to come home and is in a wheelchair or walker. So, just things like that to keep in mind. And as an agent, maybe even networking with like construction companies, like, oh yeah, they specialize in that, or, remodeling companies, or even knowing what is available for DMEs and what's not, I think is a huge help to your clients.
Absolutely. And, I think the biggest thing to remember is there are a lot of things that are covered, and many of those are things you also might not think of. So, for example, prosthesis and orthotic items, lots of certain types of braces, artificial limbs and eyes.
Yeah, I didn't even think about eyes when we were talking about it initially.
Absolutely. Breast prosthesis for breast cancer survivors that have had mastectomies, ostomy bags, urological supplies, certain cases, therapeutic shoes or insoles with people who have diabetes-related foot diseases. Those are all, again, going to fall under that 20% copay. And again, if you have a Medicare supplement, you may not actually see those costs. If you have an Advantage plan, you are more likely to see those costs. again, there is coverage available for many of those things.
So I think the biggest takeaway with that side is just knowing what suppliers, or even if you don't know, just knowing how to help your clients find suppliers that do accept assignment so that they are getting it covered by their Medicare and their Supplement or Advantage plan. Corrective lenses, we even went through that too. So contact glasses, conventional glasses or contact lenses after surgery. So there's several different prosthetic lenses that we talked about earlier, but it is interesting. That was a side of DMEs I didn't even think about until we did a little research for this podcast. So the other aspect that we'll dive into is medication and oxygen used with DMEs. Yeah. That's a whole nother avenue. So one of the biggest things that we talked about was diabetes.
Of course.
Diabetes, as long as you are getting a insulin pump, that is actually considered a DME glucose pump, the insulin is covered under Part B, not under Part D, as in dog.
Yep. And as of July 1st, 2023, Part B insulins are also capped at $35 per month under the Inflation Reduction Act. So that is one of the rare exceptions where that 20% coinsurance is not what you will pay.
Correct.
As long as it's covered for that pump, you'll still only pay that $35 maximum per monthly supply.
Yeah, and so some other things that we discussed was CPAP and nebulizers, same thing. If you are getting a DME, the durable medical equipment device, then the oxygen or nebulizer, sorry, I jumped ahead. Nebulizer for CPAP, all the medication that goes into that is also covered. So then that we can jump to oxygen, because that was the other thing I mentioned. That is also something that is covered with some stipulations.
Yeah, oxygen gets really, really fascinating. So if you're getting liquid oxygen or gaseous oxygen, keep getting things paid for up to 3 years, a 36-month rental period to rent the equipment to run those tanks. And then, interestingly, the supplier then has to keep you with that equipment for another 2 years after they stop getting paid for it. And then the payment cycle can renew. So it's a really interesting case. And again, this is why DME gets so complicated, because it is sometimes difficult to find providers that are willing to deal with this frankly archaic and complicated process of claims and billing.
For sure.
It is a mess for certain devices.
Yeah, we were reading it going, well, that's interesting. They have to do
that
what?
was the third time we read it.
Yeah, I think
we
read
the first couple,
times.
it was just like, okay.
So speaking of like the archaic, we were talking about renting versus owning. That also varies a little bit on like how Medicare covers it, and some of it is your choice. But we even had a coworker who needed a scooter, and she chose to buy it instead of renting it because it was way cheaper to own the equipment opposed to renting it. So you may run into that also, depending on how long that person needs it. But if you own DME, basically. Then Medicare will cover repairs and replacement parts, and they will cover the 80%. Your cost will be the 20%. The biggest thing, again, is making sure that the provider, the supplier, accepts assignment. If you're renting, it's different. Medicare is going to cover the monthly payments for the equipment as long as it's based on that type. So it'll kind of vary depending on the type of equipment, how long they'll do that. But basically, you're looking at like a monthly rental and making sure it's approved every month to get it covered by your insurance.
Yeah, and it can get kind of complicated because if you have something that needs to be frequently serviced, like, for example, a ventilator, they're going to keep making those payments as long as it is a medically necessary piece of equipment. But you can definitely see where someone might have issues getting that approval renewed on a periodic basis. And folks can actually be without their DME if they're not really on top of it, which is increasingly difficult as the medical system gets more and more complex. Now, if you are done with a piece of equipment, the supplier is going to pick it up. They're going to, any costs for repairs or replacement parts, they're going to be their supplier's responsibility. That's part of their rental agreement and how they're contracted with Medicare. They're going to pick up rented equipment if it needs repairs. You don't have to take the equipment back to a supplier necessarily. So there are some benefits to renting versus owning. Not being responsible for those repairs and replacement parts is definitely one of the benefits, but a lot of it depends on how long you plan to use a piece of equipment and then again, what type of vendors you're able to find, which, my goodness, what a task.
Yeah, and I was even looking at the definition of renting. It says the supplier will also pick up the rented equipment if it needs repairs. Okay, so now you're relying on a supplier to come in a timely manner to pick it up, repair it, and get it back to you, especially if it's a needed item. It's not saying that they'll replace it. They're saying that we'll repair it. So just thinking through like the logistics of, my God, finding a supplier that's willing to deal with the logistics of the claims and billing process is sometimes a little difficult. So that's where the best place to go is there's a part of a website on Medicare.gov. It's medicare.gov/medical-equipment-suppliers. I'm sure if you in the search bar type in DMEs or DME suppliers, which is probably what we did when we were researching this particular episode, but going in there, at least you can help figure out who is actually accepting assignment, who's taking Medicare, and that if you're specifically looking at a Medicare Advantage plan, then you're going to want to work with that particular Medicare Advantage approved supplier.
Definitely where it gets a little more complicated. So yeah, sometimes may have one single national supplier or just a couple national suppliers working with an MA plan. So finding that in-network source is, again, if you've got clients using DME, I would make that just as important to you as talking about their drugs and their doctors. If you've got clients using durable medical equipment, that is as big a potential cost to them as a hospital stay. Because on most Medicare Advantage plans, they're going to pay that 20% copay on their DME. That can rack up just as fast on a monthly basis as something like a hospital stay would. So definitely something to add to that, client intake form, that appointment process, however you collect information, asking about DME, even having a list of some examples so folks know what you're talking about when you do that intake process.
Yeah, and even just making sure that there's like a supplier that maybe they've already gotten comfortable using, if they're currently using it and you're switching to a different Medicare Advantage plan, making sure that their continuation of utilization of that DME is going to stay there, just making sure all that. So I love that you brought that up as a takeaway, because it could drastically affect their finances and really their mobility, because a lot of these DMEs are walkers and wheelchairs.
Yep. Struggling to find a DME company to replace a walker that's getting worn out is one thing. Struggling to find a DME company to take over your oxygen deliveries is a much different conversation to have. Both equally important, but it's a conversation a lot of people aren't having right now as they meet with clients. Now, if someone walks in with an oxygen tank, I'm sure you're going to ask about it, but if they only use it at night, or if they don't have, the nasal cannula with them or something like that, you may not notice or you may not know. So adding DME to that conversation. And then the other thing is people who do use equipment, or maybe Medicare beneficiaries who don't use DME, are, as with most sectors of the industry, subject to an unfortunate number of scams and schemes to get money from the federal Medicare program.
Yes, this was a fun part of researching. Not fun in particular for the people who get scammed, but just at least knowing what type of scams are out there, and what you can warn not only your clients, but anyone who is a family member, a friend, anyone who potentially could be a target for this. One of the biggest scams that you've seen publicly, because we've seen a lot of different news articles and things like that, but in 2019, so that basically walkers and braces for free, billed to Medicare for it, but they're not actually utilizing it or needing it. So sometimes they were scamming, collecting the information, billing Medicare, and then not actually, they didn't actually need it. So we actually looked it up. It was a scam in 2019. Basically, they scammed Medicare for DME equipment for $1.2 billion in losses. So it didn't necessarily hurt the clients, but it is affecting the funds that Medicare has, which is going to indirectly affect how much Medicare costs down the road for all of us.
Absolutely. Definitely cutting into the trust fund there. Also putting things on that client's medical history that may not be accurate.
Yeah. That is a very good point.
Oftentimes we see these associated with doctors that are willing to write bad prescriptions for services that are never received or never needed. So having that, having some condition that your client didn't actually experience on their medical record can impact their ability to underwrite into certain other health products. It can impact their eligibility for certain services. It is definitely something that can impact the beneficiary down the road, but again, huge impact to Medicare Trust Fund long-term solvency as well. So go ahead.
Sorry, I was say, which is a really good point, knowing that it can affect their underwriting ability. Just knowing as an agent, you can pull, or the client can pull their medical records. They legally can do that. So if they ever get dinged on an application for underwriting, and then when they ask the carrier why, because they're like, I have no idea why, the carrier can send a letter in the mail to them. So you can walk your client through that once they get that. If there's something like a walker or wheelchair on it, which can be a medical underwriting ding, they can request to pull that information and even fight it. So that's another thing as an agent you can help them with.
Yeah, absolutely. And some things to watch for, things to educate your clients about. If they get any supplies in the mail, whether it's wheelchair, walker, ankle brace, incontinence thing, if they get something in the mail that they didn't request and don't need, it's a good thing to potentially report. There's some great places where you can report fraud, waste, and abuse on Medicare.gov and the Office of Inspector General of HHS. But again, look for things on the explanation that don't make sense, services you never received, or someone getting billed for something after they passed away, even suppliers requesting Medicare numbers at presentations, or if someone offers you money or gift cards to give your Medicare number, or if someone gets you an off-the-shelf product like a Ace Wrap from Walmart, but then bills Medicare for a higher quality ankle brace that actually has a prescribed use. So different things that you can kind of help clients look out for, be aware of, that might point to fraud that should be reported. But again, big takeaways are just, with DME, it can be such an important cost outlay to those clients. Finding providers to network with, helping clients looking out for scams, making sure that you're keeping an eye on those networks for MA plans in particular, and looking at out-of-pocket expenses are some of the big takeaways that I think most agents should be looking at.
Yeah, and I think also knowing what is not DME and what isn't being covered, you're looking at a lot of things that people assume are covered, like the home modifications being a big one, where why isn't a grab bar and a shower covered? Like, that should be, but, things that allow that person to live a normal life with their activities and daily living, a lot of them aren't covered. So just knowing what you can inform your clients on what is covered, what's not covered, helping them with suppliers, even networking with suppliers. If you haven't picked up the phone and made a couple phone calls and introduced yourself or asked more questions, that's another good takeaway. There might be some local suppliers too that you could even reach out to. A lot of the suppliers are part of pharmacies as well, which is a really good walk into a pharmacy, have that conversation with them just to see what products and DMEs that they offer and what carriers they represent, if they're a particular supplier for that MA plan. So between networking opportunities, education for your clients, resources, and just overall knowledge about the industry, I think there's a lot of takeaways about DMEs that you can use to help your clients.
Absolutely. I think durable medical equipment doesn't need to be scary or concerning for agents, but I think it can be a major concern for clients. So having a conversational knowledge of how the process works is definitely going to help you in meeting with those clients that use durable medical equipment and helping give them informed choices as to their care. With that, I think we'll leave you for this episode, and we'll talk to you all again soon.